That's right, the doctor's in with Cold Seal, introducing Cold Seal lozenges, your fast-acting relief this winter. Combat common colds and sore throats with the soothing power of Cold Seal lozenges, available in different flavors: ginger, cinnamon, honey, lemon, honey, propolis, orange, vitamin C, anise. Specially formulated for rapid relief. They're available at all leading pharmacies and retail stores nationwide. Stay protected this winter with Cold Seal. Speaking of Cold Seal, we've got a guest in the studio, a pharmacist by the name of Tatenda Machiha. Good morning, Tatenda. How you doing, my guy?
I'm good. How are you?
Pretty well, thank you.
How's
Thank you for joining
everything,
us.
Tatenda?
Everything is good.
Je sais beau. Lovely stuff, man. Let's talk about pain today. Pain and pain management. Every single human being on earth at some point in time is going to get hurt, going to get injured, and there will be pain involved. Let's talk pain management. What types of pain do people usually self-medicate on or seek medical attention for? What do you reckon?
Yeah, you'd find mainly it's for acute pains. Those with rapid onset. You find your headaches, your menstrual pains, your joint pains, your back pains. Those are the ones that are regularly self-medicated for.
All right. So when should we, is it okay to just, I'm feeling pain, get medication, or you should, at some point seek help?
Much like any painkiller.
Yes, so in self-medication, it's usually whereby a patient is going to be taking medication without any prior consultation with the pharmacist or the doctor. So for those, we would recommend taking for acute pain, that's pain which you have experienced for a period that's not more than 3 months. So you find if you have a backache and it's been like for 2 weeks, yeah, sure, you can definitely self-medicate with your medication that's available over the counter in the pharmacies. Those are the likes of paracetamol, the likes of ibuprofen. But now, if it comes to a case whereby the condition is prolonged for a period lapsing more than 3 months, there's definitely need for consultation with the doctor.
Okay. Are there any risks maybe associated with taking painkillers for a very long time, a prolonged period of time?
Yes, indeed there is. So usually taking painkillers, especially if you are taking the maximum dose, you are likely to increase or potentiate the side effects to a larger extent. So I'll take an example, ibuprofen. If you take ibuprofen for prolonged periods, at the maximum dose, you are likely going to increase the risks of stomach bleeding, which at times leads to ulceration. Yes.
All right. So in the event that Simba has medication at the house, but he's got one Paracet and one Brufen, can he mix?
Can I take them? I fell, I bumped my elbow, I'm in serious pain.
Can you mix them?
And I'm like, you know what, I've got one ibuprofen,
Yeah,
probably
and
a
one
high
Paracet.
dose and one Paracet. Can I take the two? Or must I now go and consult a pharmacist or my
To
doctor?
say is balance.
Yes, yeah. So on that case of mixing, it's actually better to go and consult, because you find at times you are taking maybe a medication for cold relief, those are colds and flus, as well you are taking a medication for pain. So at times these cold medicines already contain some of the painkillers. So at times you might be taking a remedy for a cold which already has Paracet, and then now you are taking Paracet as well. So end result is at times you end up overdosing. So it's always good to consult. And also at times you find some medications interact. They are drug-to-drug interactions. Some of the interactions actually make the combination not beneficial at all.
Okay. All right. So I was going to double up.
Yeah.
You're not doubling up on good medicine. You might actually be messing yourself up instead.
Yes.
Okay.
How do you know you've grown a resistance to a certain medication? Now you need a higher dose.
Higher dose.
Yeah, painkillers especially.
Yeah.
Yes.
So if previously you were taking one Paracet for a headache and it would resolve, and now you're finding that one same tablet is not resolving your headache, then to some extent you say you've developed some sort of tolerance, because you find maybe now you need 2 Paracets to relieve the same pain.
How long does that period? How long does that take for you to start developing that tolerance?
Yeah.
Approximately.
Yeah. So I would say it's drug specific as well as individual specific, because our tolerance levels as individuals vary. that's to do with receptors, be it for pain medications. You find I'll have maybe lesser pain receptors to the next person. So maybe more me, it's going to take probably longer for me to get to that stage of tolerance. As well as for medication, there are some medications which are actually addictive. You find the likes of opioids, your morphines, your pethidine. So those kind of drugs, they actually, taking them, you're actually putting yourself at risk of developing tolerance as well as dependency on the same.
I was going to ask you, you've mentioned Paracet, and taking different types of medication could be detrimental to you. If you take a Paracet and an aspirin, is that a problem? Or you have to if you take aspirin, you're taking aspirin. You're taking Paracet, you're taking. And obviously, I bring this up because you know how it is. Somebody will come into your office and say, "Yo, I've got a headache."
And then
you don't know if this person's allergic to aspirin. You don't know what might happen. But could be a problem. So when I ask you, can you mix aspirin and Paracet, or do you have to take aspirin or Paracet?
Yeah, on aspirin and Paracet, I would say there's no problem. But the problem now comes if you take maybe medications that are in the same class. For instance, aspirin is called a non-steroidal anti-inflammatory disease, NSAID. Sorry, let me just shorten. It's called an NSAID. Same goes for Brufen.
Okay.
So these drugs, the most common side effect is gastric bleeding. So you find, and also it raises your stomach acid level. That's when you get things like my acids. Yeah, you get. So if you are going to combine Brufen and aspirin, you are likely going to increase the risk of that. Yeah.
Okay.
So some medications you can, for instance, aspirin and Paracet, well and good.
Okay.
You can, but aspirin and ibuprofen, there might be a problem with that.
All right, and I guess we are about to shut this down. I'm just going to ask you one last question. My pain meds, I don't tell you. You know, when you're like, oh, I've got a headache, and the next 5 minutes you're expecting something to happen.
Yeah, you take a
What time?
Paracet.
Like, how long does it take for meds to actually
Normally.
kick in?
Yes, so
And is it better on an empty stomach?
so it, on that one, it's a case to case basis.
Okay.
So for paracetamol, you find it's a fast acting. Within 15 minutes, you should be getting some relief. For
Okay.
some, they take longer, and for some, you actually need to take with medication, with food. Sorry, because taking the medication without food in the stomach will likely result in irritation of the walls of the stomach. So that's for your ibuprofens and your aspirin. You definitely need to have eaten something. But for paracetamol, you find it does not interact with your gut, so you can easily take even without having any food.
Okay. If you have a hangover, what should you take?
Hangover.
Yeah.
Water.
Water.
Raw eggs.
Yeah.
Somebody once said to me, take a Paracet as soon as you get home. If you've been out drinking, take a Paracet. Some people say Paracet on lots of alcohol is a very dangerous thing. So this is the words that are going around now. What do you recommend? What do you suggest as a pharmacist?
Yeah, so Paracet is an effect on the liver. So you find if you take too much paracetamol, it affects the liver as well as alcohol as well. Because now your liver is trying to fight the alcohol out of your system. And you take Paracet, which also affects the liver. So on that one, I might say I do not recommend that. But rather, you might take... what are these oral replacement fluids? Yeah, your ORS, the salts. Yes.
Okay.
Those are really beneficial because now when you drink, you're dehydrating, you're passing out a lot of water, you're losing a lot of minerals, and so forth. So you just need something to replace all those lost minerals.
Okay. So it's Puza Thursday, so I had to ask this question for those
You know
who
what?
be going out.
I thank you on behalf of all of those that will be going
Yes, 100%.
out. You're so silly.
Shout out to our pharmacist, Tatenda Machiha. Thank you very much for joining us this morning and talking to us about pain management, and effective pain management as well. I'm sure we'll have more conversations in the not too distant future, but thank you for joining us today.
Thank you
Thank
so
you
much.
guys. Thank you. Sure.
That was